Colorectal cancer has long been perceived as a disease of the elderly. However, a disturbing trend has emerged in recent decades, shattering this long-held assumption. The incidence of colorectal cancer among young Americans is steadily rising, painting a worrisome picture for the future. From 1999 to 2020, rates of colorectal cancer in adults aged 20 to 39 rose significantly. This surge is particularly alarming given that colorectal cancer was once rare in this age group. While the absolute numbers might appear modest compared to older populations, the upward trajectory is deeply concerning. This shift suggests a fundamental change in the dynamics of the disease. Experts fear that this trend, if left unchecked, could have dire consequences for public health. The medical community is grappling with this evolving challenge, striving to understand the underlying causes and develop effective strategies for prevention and early detection. The reasons behind this alarming rise in colorectal cancer among young adults are complex and multifaceted. Traditionally, screening for colorectal cancer has focused on older adults, those considered to be at higher risk. Guidelines recommend routine screening for individuals over the age of 50. As a result, younger adults often fall through the cracks, their symptoms potentially dismissed or attributed to other, less serious conditions. This delay in diagnosis can have devastating consequences. Colorectal cancer is a silent predator, often developing without noticeable symptoms in its early stages. By the time symptoms manifest, the disease may have progressed to a more advanced stage, making treatment more challenging and reducing the chances of survival. This underscores the need for heightened awareness and a shift in our approach to screening and prevention. Recognizing the early warning signs of colorectal cancer is crucial, regardless of age. Persistent changes in bowel habits such as diarrhea, constipation, or a feeling of incomplete evacuation should not be ignored. Blood in the stool, whether bright red or dark and tarry, is another red flag. Abdominal pain, cramps, bloating, or discomfort that persists for more than a few days warrant medical attention. Unexplained weight loss, fatigue, and weakness can also be indicative of colorectal cancer. It is important to remember that these symptoms are not exclusive to colorectal cancer and can be caused by other conditions. However, experiencing any of these symptoms, especially in combination, should prompt a visit to a healthcare professional for further evaluation. Early detection is key to improving outcomes and increasing the chances of successful treatment. Section 4. Navigating the labyrinth of risk factors. The reasons behind the surge in colorectal cancer among young adults are multifaceted, encompassing lifestyle choices, environmental factors, and genetic predispositions. Modern lifestyles characterized by sedentary behavior, processed food consumption, and high stress levels play a significant role. A diet low in fiber and high in red and processed meats has been linked to an increased risk of colorectal cancer. Environmental factors, such as exposure to certain chemicals and pollutants, are also believed to contribute to the rising incidence. Furthermore, a family history of colorectal cancer or a personal history of inflammatory bowel disease can increase an individual's susceptibility. Understanding these risk factors is essential for developing targeted prevention strategies. Section 5. Charting a course toward prevention. While the rising rates of colorectal cancer among young adults are undoubtedly concerning, there are proactive steps individuals can take to mitigate their risk. Adopting a healthy lifestyle is paramount. This includes consuming a balanced diet rich in fruits, vegetables, and whole grains, while limiting processed foods, red meat, and sugary drinks. Regular physical activity is crucial, aiming for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week. Maintaining a healthy weight and limiting alcohol consumption are also essential. For individuals with a family history of colorectal cancer or other risk factors, talking to a healthcare professional about personalized screening recommendations is crucial. Section 6. A call to action: early detection saves lives. The alarming rise of colorectal cancer among young Americans necessitates a multifaceted response. Evolving screening recommendations to include individuals under 45, particularly those at high risk, is critical. Public awareness campaigns are essential to educate young adults about the symptoms of colorectal cancer and the importance of early detection. Further research is needed to better understand the underlying causes of this disturbing trend and to develop more effective prevention and treatment strategies. By fostering greater awareness, promoting healthy lifestyles, and ensuring timely access to screening and care, we can slow the rise of this preventable disease and save lives. The time to act is now.